The advice and opinions expressed by the host of Autism Live and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice. The Center for Autism and Related Disorders advises working with a board-certified behavior analyst who has experience with autism before starting any intensive behavioral intervention. Any choices you make in determining your child's treatment are completely at your own discretion.
Good morning and welcome to Autism Live. I'm Shannon Penrod. We're webcasting to you live from the Center for Autism and Related Disorders headquarters in Tarzana, California. It's Wednesday. There's a lot going on here today. I want to start by telling you that Dr. Doreen Granpeesheh is not here with us today. I had mentioned yesterday that she wasn't going to be here with us. What we're going to do during this hour is replay, sort of the best of the best of the best. The things that you guys ask the most about is anxiety. So in just a few minutes, and Emily is, we'll cycle through everything in just a second, but Emily will start the tape to play the recording of the second part, the second half. Can you tell it's just one of those mornings? The second half of the anxiety show. Dr. Granpeesheh at the end of last year did a two-parter for us where in the first part she went through the DSM-5 and the classification for anxiety, what it had to do with autism, and detailed it all at length so you understand exactly how anxiety and depression and obsessive compulsive, all those things, how they're defined and how they fit into a diagnosis. Really informative, and I want to encourage you to watch that on your own time. It's available on our YouTube channel, on our Roku, on iTunes, all of those different things. It's the Anxiety Show Part 1. But then the second half, which we're going to show you today, she really gets into, she kind of recaps it a little bit and then gets into the nitty-gritty of how we address anxiety in individuals on the autism spectrum, and honestly, individuals who are not on the autism spectrum, and answers a lot of questions that came in on the live feature. So we're going to play that for you. I think it's a really good way for us to spend this hour. My heart is broken that we don't have her here to answer some of the questions that we've had come in. One in particular, the person who wrote into me wanting to know, how do I block my adult son from hitting his head on the windows in our room? I want you to know I want to save this question for tomorrow. Dr. Jonathan Tarbox will be here with us in the second hour tomorrow, and I want to save this question for him so that you get a really good answer to this question, okay? And I'm sorry for making you wait one more day, but we will definitely get you an answer to that question. And if you want to, send me an email address and I'll get an answer for you before tomorrow. But otherwise, we'll cover it on the live show tomorrow in the second half of the show, okay? Because that'll keep me up if I don't address that. Now, also want to tell you that in the second hour of today's show, Nancy Alspaugh-Jackson will be joining me for Let's Talk Autism. We will be live during that hour. And we have two remarkable guests who are going to be here with you. Tammy the Swim Chick is going to be here. She's written a great book for us about understanding how to teach children and individuals who are on the autism spectrum swimming, how to be safe in and around the pool and around the water, make it a very reinforcing activity. And we want it to be fun and we want it to be safe, right? So she's got some great tips for us on how to do that during this month, which is National Drowning Prevention Month right now. So thrilled to have her. And then we also have Doug Marrone is going to be with us talking about the Ride for Autism and how you can participate. Before we go to Dr. Doreen, I just want to say for anybody who is in the Los Angeles area and is watching us live, today at CARD headquarters, we have a special blood drive that is going on for one of the people who works here at CARD. His daughter, Grace Ellen, has, I'm going to get the name wrong, it's acute lymphoblastic lymphoma. Forgive me if I've gotten that wrong, but Grace is 4 years old, and so we're holding a blood drive here. If you are in the Los Angeles area and can get here before 2 o'clock, then please visit us. The blood drive van is in the back parking lot. We will give you free valet parking. Please be a part of that. Welcome walk-ins, and you must be 17 years old and in good health. If you are not in good health or not 17 years old and not in the Los Angeles area, share it. It's on my Facebook page right now, my personal Facebook page, Shannon Penrod. Share that information so that we get more people here to support this family and this beautiful little girl, 4 years old. Okay. So having said all of that, I'm going to be back with you live at the top of the next hour. But first, very special treat from our archives, the second half of the Anxiety Show with Dr. Doreen. It's time for Ask Dr. Doreen.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism. Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
I'm gonna just go through today and try to fit as much as I can in 1 hour. I know that last time we got into a little bit of discussion about different aspects of anxiety and the DSM, and we were not able to really get to the core of it, which is some of the treatments and things that we can do for our kids. So today I'm going to try to go a little bit faster perhaps and go over some of the basic details and then talk more about treatment.
Great.
Sounds
Go right
good.
ahead. It sounds wonderful.
And so if I'm going to start, and for those people who did attend and watch the November 27th show, forgive us if it's going to be a little bit of repeat material.
We love a refresher.
Okay.
Refresher's always good.
So we're going to talk about anxiety and OCD, obsessive compulsive disorder, and how they have overlaps or comorbidities with our field of ASD, or autism spectrum disorders. So we're going to talk very briefly about how we can identify anxiety in ourselves, because I sort of want to make sure that the listeners are able to identify what anxiety actually is and some of the symptoms. And if you get good at identifying it in yourself, then it helps you very much to identify in your children, especially our children, because our children, of course, have a very hard time expressing it when they have anxiety. So, and we'll review what is anxiety, what is OCD, and what are some of the signs of anxiety and OCD that we see in ASD and autism. And then I'll throw out some ways that we've used in the past to assess anxiety in our kids, and we'll talk more about treatments then.
Great.
Okay, so we talked about the definition of anxiety, and again, for our viewers, this presentation in its entirety will be up on the Act Today website, the CARD website, the autism-live website, so that people can access it freely.
Absolutely. And
possibly even the video might go up as well, so that people can see this. Okay, so anxiety is really a normal reaction to stress, and it does, a certain level of anxiety is important. If we had no anxiety, nobody would leave their house and you'd just stay in bed and not care about anything, right? So a certain amount of anxiety makes us functional, and so that's kind of important to know. It helps us deal with difficult situations, and often when you look at people who are good high performers on examinations, for instance, those are people who have a mild level of anxiety and not the people who have no anxiety or high anxiety. So just so you know, a mild level of anxiety is a healthy thing. Okay?
Good to know.
Now, when we look at ourselves, the things that we tend to call anxiety, and this was something I just polled a bunch of friends. And I said, when you feel anxious, how do you feel? What are some things? And these are the things they listed out for me, and it might not apply to everyone here, listening, but, here they are. I worry, I'm afraid, I don't sleep, I don't eat, I eat too much, I obsess about things, I have racing thoughts, I have heart palpitations, I have irritable bowel syndrome when I'm anxious, I feel dizzy. Mm-hmm. So people feel anxiety differently, okay? I think for me, I have racing thoughts and I don't sleep. Other people have different levels of anxiety. How do you experience anxiety, Shannon?
I think I have everything on the list except don't eat.
Okay, sadly. Sadly, that's the one you want to have. Yeah. And then if you think about how do I deal with anxiety when you have those symptoms, right? What do you do? And here's again, same group of friends, I distract myself, or I keep myself busy. I talk to my friends. I gain reassurance. I pray. I take medications to help me. I exercise. I breathe. I meditate. I do yoga. I practice positive self-talk. I try to change my beliefs. I avoid what's making me anxious. I take drugs or alcohol or other addictions. I try to change what is causing me anxiety. Okay, so 2 points about this list. Some of these things are adaptive, like, you know, kudos to those people who actually exercise when they have anxiety. What a wonderful thing to do. Or meditate or do yoga. And then some of them are not so adaptive. They're not very, it's not a good idea to drink alcohol when you have anxiety. And the idea here is that people deal with anxiety in different ways. Sometimes if it's overwhelming, you might end up doing something not so good. And if you're able to, I guess if you've dealt with it more in your life and you get better at dealing with it, right? And the second point about this slide is that when you look at these things, you have to realize that our children don't know how to do most of these things. When kids experience anxiety, any child, they don't really know how to cope with it. They don't have these, what we call coping mechanisms. Whether they're good or bad, kids don't know how to do any of these things, usually. So they just, you know, go into the previous slide, which is they just continue to worry. They just avoid. They just, you know, they do things that are, they just experience it over and over. They don't know how to reduce the experience of anxiety. And that's important because that takes us to treatment. Right?
And absolutely, and I feel like even already knowing that, it makes me so much more motivated to provide my child with skills to be able to cope.
Exactly.
Because if I didn't have skills to cope, it would escalate.
Exactly.
And I would feel terrible allowing that to happen to my child.
Right. And you know, it's important to just the 2 slides that we went through. What I want our viewers to hear is, you know, you will sometimes see symptoms in your child and you won't relate it to anxiety. So, for instance, let's see, child's not sleeping or not eating or obsessing about things. Now, this is very important. When we see those obsessions, for me, the number one thing is, why does he want things to be a certain way? Why is he all of a sudden now concerned about things being perfect? Those types of things are clear indications of anxiety. And before I start, as I start to try to teach my child not to, you know, line things up or not to insist on things being perfect, I also want to teach him some coping mechanisms.
Absolutely.
So there's 2 sides to it. So this is just kind of like, let's let our viewers think these things through.
Sure.
Okay. Now, as behaviorists, the way that we have to remember, and I'll go back to what the behavioral concept of any behavior is that everything we do is to get something good or avoid something bad. Remember, that's what I always say, right? Feeling anxious is obviously something bad. It's not a good feeling. So sometimes what we do is we avoid all situations that cause anxiety, right? Like examples of this are not wanting to go to school. Maybe some of our kids don't want to go to school because they're anxious in that environment. They don't want to go to a party where there's a ton of noise because the noise level makes them feel anxious because it's too intrusive. They don't really want to go to social situations because they're not good at being social. These are just examples. And if you can't avoid the situation that's making you anxious, then you tend to do things that will help you cope. Some of the things you do to cope are good, and some of the things you do to cope are not so good. They're all coping strategies. Even if so let's say something that is good, a good way of coping is let's say they force you to go to, here's a good example. People don't realize the number one thing, public speaking is a huge anxiety-provoking situation for most people. So let's say I force someone who doesn't like public speaking to go into the public speaking situation, and boy, they start showing all symptoms of anxiety. They're nervous, their hands are shaking, they're sweating, all that sort of stuff, but I force them to do it. Now they're going to start to cope. Now some people will cope in a way that's adaptive. So, prior to going, they'll practice a lot. They'll breathe. They'll know, they'll start to push their thoughts, their anxiety thoughts away, and so on. Other people will do things that are not adaptive. They'll have a tantrum. They will, refuse or throw things away, around or whatever. They'll put up a fight, So coping mechanisms are good and bad.
Okay.
Okay. With all these coping strategies, what are we trying to gain? When we do coping strategies, we're trying to avoid or reduce anxiety. We're trying to find other things that are rewarding so that they replace the anxiety. That's why we eat, right? Overeat or drink alcohol or whatever. We're trying to reduce the anxiety by replacing it with something else. We try to gain better understanding of what is causing us anxiety, and we want to change our perceptions and beliefs, because anxiety altogether is just something we believe, right? People who there's some people that are very, very comfortable with public speaking. I have no anxiety about public speaking, but other people who find public speaking to be extremely anxiety provoking. So if one child finds a social situation to be anxiety provoking and another doesn't, it doesn't mean that our child who's anxious is doing anything wrong. People are different. Their skill set is different. The very, very first time that I spoke in front of 1,000 people, I was pretty anxious, and I rehearsed my talk maybe 20 times. Now I will go and do a talk with absolutely no rehearsal, and I'll just talk to the audience. So practice or knowing content or knowing what we're doing helps us reduce anxiety. And that is really important when it comes to our kids, because our kids have learned the language recently. They have learned social skills recently. And all of these skills are new to them. So when we force them into situations where we feel they shouldn't really be anxious, we're wrong. They have every right to be anxious. We're asking them, our kids should be anxious every single time they get into a conversation because it's brand new to them.
But that's not a reason to not have them do it.
Oh, absolutely. You will continue to place them in those situations. But as we go on, and you'll see, there's a lot of things you can do to gradually fade the child in, to give the child other forms of support, to make the situation more palatable so that the child doesn't go to high-level, horrible other coping mechanisms that are not good.
Okay.
We tend to do drastic things when we're placed under a lot of pressure all at once.
Yes.
And if we are gradually exposed to things, then we tend to cope better and have more healthy coping strategies.
Because I sort of see it as the avalanche, that the child has some anxiety, and maybe we don't even realize it's anxiety, but we take them to a birthday party and they have the meltdown because of the anxiety. And then the next time the birthday party comes up, the child is showing reticence, and then we have anxiety about it because we don't want to go through the thing, and so it just becomes this mushroom cloud.
Right, absolutely, very good example. And if in that scenario, if the child had been prepared a little bit more for the event, the whole thing would have been more successful. So it's just a matter of preparing ourselves a little bit better and perhaps reducing the exposure to a gradual exposure. When you have a situation like taking a child to a party and they don't have the skill set, or B, the noise level is too high and it's bothering them, or C, they're not allowed to even reduce their own anxiety by eating a lot of the foods because the foods are restricted. So there's a lot of stuff that goes on. When you're doing that, you're flooding. That's a procedure called flooding, and you're basically exposing the child to multiple aversive stimuli all at once. Versus shaping, or a graduated type of, procedure where you're not really placing the child in a horrible situation, you're just gradually increasing. Well, I'll give some examples.
Okay, great.
So, did I go through the slides? Yes. So if our children now this is going on to talk just briefly about how difficult it is for us to even see anxiety in our kids and to identify it. And again, remember I think it might come up in this presentation, but in autism, because it's such a pervasive disorder, people tend to it overshadows everything else. We've talked in the past about, like, so many of our kids have gastrointestinal issues, and you know, the doctor will tell them something like, oh, that's just, a lot of kids with autism have GI issues, which means nothing.
Yeah.
You know, and we just tend to then ignore those issues. And it's the same thing with anxiety. A lot of our kids have anxiety. That doesn't mean we have to ignore it.
Right.
It's not one of the symptoms of autism. It's one of the side effects of just not having enough communication ability and having too much intrusion and not being able to fit in and so on. So then you feel anxious.
But I think that's why this conversation is so important, because I think a lot of us have felt helpless about our child's anxiety.
Right.
Like, is there something we can do?
Oh,
is there a
totally.
strategy? And that's why I'm so thrilled that you're talking about this.
Absolutely, and that's the thing, you know, in when we put it into the bucket of autism, then we feel like, oh, that's pretty scary, right? And I just can't deal with this. But it's because the bucket of autism is so just hidden, and like nobody knows how to deal with this huge thing in there. You
It's
know,
mysterious.
Mysterious.
It still has this
exactly.
air of mystery.
Exactly.
You know, the doctors act that way, like, well,
oh, nobody knows how to do it.
Yeah, right.
But anxiety is anxiety, and there's been for hundreds of years ways to treat anxiety, and you'll see that some of these treatments will be very effective for our kids.
Okay, well, awesome.
So, you know, if our kids had anxiety, would we even know it? How would they show us? It's very important for us to see this. What ways do they have to cope? And what techniques do they know to calm themselves? And can we help reduce what causes them anxiety to begin with? So it's one thing to say they're anxious, let's teach them coping mechanisms, which we will. But the other thing is, remember, everything, you want to change consequences and antecedents. Can we actually reduce some of the stuff around them so that their anxiety level is low to begin with?
Okay.
So there's many ways to think about it.
Okay.
Our goal is to recognize anxiety in our kids, help them recognize what makes them anxious, because you're not always going to be there.
Right.
So you want your child to be able to realize, okay, I'm going to be anxious. The reason my heart feels this way is that I'm experiencing anxiety. This is what I need to do. Help find good coping strategies. Help them feel confident enough to approach situations that they feel anxious about. Help them overcome their anxiety overall, and then help them find ways to reward themselves, right? Because you want your child to be independently able to push themselves. My son, he gets very anxious about memorizing new academic information, which is really interesting. Like if it's, last time we were practicing French and he was saying, I just can't get this stuff, I have horrible memory, which is fascinating because he's an actor, he loves acting, and he memorizes books of script, books, like literally, you know, way beyond my memory. And what he doesn't realize is memory is memory.
Right.
It's just that he knows he will be successful memorizing script, but he feels he will fail at memorizing French. You know what I mean? So it's sort of an interesting thing. And the main thing is to teach our kids, okay, this is how I go about coping with this. I'm going to introduce myself to this scenario gradually. Because as long as someone else is pushing you, you're going to have resistance.
Yeah.
So it's important to teach our kids to approach it themselves. We went through this a little bit last time now, this slide, where we talked about in DSM-4, anxiety had, the anxiety disorders were defined this way, and there were, you know, it was panic disorder, separation anxiety, specific phobias or fears, social phobia, obsessive compulsive disorder, post-traumatic stress disorder or PTSD, generalized anxiety. These were all classified in the chapter called anxiety in the previous diagnostic manual. In the new manual, in DSM-5, it's a little bit different. They actually have added a whole section now, and what they've done is for anxiety disorders, they've detailed it a little bit more. So we have separation anxiety, selective mutism, which we talked about, which is sort of kids where you will essentially in certain situations you freeze and you don't speak, you don't talk. Specific phobias, again, social anxiety or social phobia, panic disorder, agoraphobia, which is a very extreme level of anxiety, which prevents you start to stay at home and don't want to leave your environment because you only find your own environment to be safe. Generalized anxiety, which is anxiety in more than one situation. Substance or medication-induced anxiety, which essentially means, and this is actually a very good one that they've added, because a lot of medications, like medications for ADHD, will tend to increase the heart palpitations, and sometimes you misunderstand that feeling and consider it to be anxiety. A lot of medications do that, actually. Anxiety disorder due to other medical conditions, like let's say if you are going through chemotherapy or something, you're going to feel pretty anxious because you feel sick, and just feeling nausea. Nausea is one of those feelings that people relate to anxiety a lot. So if other things cause you nausea, you're also going to start feeling anxious. It's funny. And then other specified anxiety and unspecified. So they've just kind of detailed it a little bit more, the anxiety disorders chapter. And they've added another, they basically are defining the anxiety disorders as things that are disorders that share excessive fear, okay? And they're clarifying in the new diagnostic manual. We did, I think, talk about this a little bit, where they said that fear is the emotional response to real or perceived imminent threat. It could be real, it could be perceived. And anxiety is the anticipation of that threat, right? So I, in my mind, think that something really bad's going to happen, whether it's real or not, and then I feel anxious, apprehensive about it before it even happens, right? And that's anxiety. Anxiety is usually about real-life events. Not necessarily, but usually. Your perception of the real-life events could be completely wrong. Like a real-life event would be going to school, and your perception of it would be, all kids are going to make fun of me today, right? So your perception might be completely wrong, but it's still a real-life event that could potentially happen.
I like when people say fear stands for false evidence appearing real.
Exactly. Very, very good. That's an excellent way to put it. And there's a huge overlap with OCD, because OCD, now they've put a new chapter called obsessive compulsive disorders. They've separated it from anxiety because they say that the fear that is in obsessive compulsive disorders is usually irrational. The only separation then is, okay, so we have, I'm going to school as a very real thing. I might have a sort of a perception of going to school that's a little bit exaggerated, like people will make fun of me, or I might say, oh, today something's going to fall from the sky and hit me in the head and I'm going to die today. And that's a little bit more irrational. And if you go to kind of things that are a little bit more irrational, and it results in you doing irrational behaviors, your behavior might become obsessive compulsive in nature. And so they're trying to make a distinction between the type of fear that leads to just a generalized anxiety or an anxiety disorder and the type of fear that leads to OCD or obsessive compulsive disorder. But I don't care. Let's ignore that for a minute, because if you can see on this bullet, there's about 76% of overlap. In other words, if you feel you have anxiety, 76% of the people who have anxiety also develop obsessive compulsive disorders. 76% of people who have OCD, it's due to some form of anxiety. Wow. So it's a high overlap. I don't think they should have divided these two. And I think the reason, and as you recall, DSM-4 did not divide them. They said OCD is a portion of anxiety, and I truly feel it is. The reason they divided it is simply because they would have otherwise had about 20 different disorders under the same heading.
Okay.
So, when we look now at the obsessive compulsive and related disorders, this is the new chapter, they say that these are characterized by the presence of obsessions and or compulsions. So you might have anxiety about something, but not obsess, okay? And so that's sort of a difference. If you are obsessing, then perhaps it has already turned into an OCD, an obsessive compulsive disorder. What are obsessions? Obsessions are recurrent and persistent thoughts, urges, or images in your head that are experienced as intrusive and unwanted. Remember in the very first slides I said that one of my friends had said racing thoughts? That's what obsessions are. Obsessions are racing thoughts. They're like, and then they will make fun of me, and then what will happen? Oh my God, and then that'll be so embarrassing, and I don't know how to handle that, and then the teacher won't stand up for me, and then I'll have to run away, and it'll be horrible. And it's just like, you know, turning things into, it's like a dream state.
Yeah.
Right? Often when we push away our obsessive thoughts, they come out as dreams.
I call it going down the rabbit hole.
Yeah,
You just keep
it's
falling
exactly
and,
right.
and you keep seeing, it's like Alice in Wonderland. She goes down the rabbit hole and it just gets worse and things get big and small and...
Exactly. And before you know it, something that was going to school, something that was kind of benign, has now turned into entering a concentration camp.
Right.
It's now turned into something horrible in your mind. And as a result, you tend to become compulsive. Now, this is the compulsive portion of the OCDs, which is compulsions are repetitive behaviors or mental acts that an individual does or feels driven to do in response to the obsession. So, you know, oh my God, they are going to torture me at school, and now I will start to do certain meaningless, in some ways, repetitive behaviors that will keep me safe. So it's one thing if I like put up a tantrum and avoid going there, but it's another thing if I have to make sure that my backpack is green, because having a green backpack will save me, or I have to check and make sure everything is perfect, because if it's not, I'm going to fail. It's going to be disaster. One of my kids, my daughter, when she was really little, was very much a perfectionist, perhaps my fault, in school. And she really wanted, she still is, you know, Nikki, she still is, and she wanted everything to be, she wanted like straight A's, you know. She got a 4.0, by the way, at the first semester, first quarter at college, yeah. And she is just was that way when she was young, and it had gradually become compulsive in her behaviors, in terms of like the night before an exam she had to go through these specific rote rituals which had really nothing to do with tomorrow at all. And we often do these things. How many people listening here or viewing this don't have a lucky something? Right? You have a lucky rabbit's foot. Where on earth did we get that from? Right. You know, that's a compulsion.
Yeah.
To have something that brings you, that you feel luck, you know, that brings you luck, or those are compulsive types of things. They are irrational. They make no sense whatsoever, yet they are mental acts. They give you some sense of security, right?
Okay.
And we often do a lot of repetitive behaviors, or behaviors as a whole, like the people who have pure OCD washing their hands because they feel that there's germs.
And then and when you bring up repetitive behaviors, of course, this is part of our autism diagnosis.
Which is exactly the slide we're going to look at right now.
Great. Fabulous.
And so, you know, again, I'm trying to help people understand that OCD, or obsessive compulsive disorders, are really anxieties. And now we're going to look at the obsessive compulsive disorders, and I've specifically highlighted in red the ones that I feel we very clearly see in our children in ASD. So these are the ones that are listed under the new chapter, right, under the OCDs. And remember, the OCDs as a whole used to be classified under anxiety, and we've already said they are 76% overlap with anxiety. This is all about anxiety.
Yeah.
The only difference is they tend to turn into coping strategies that are strange, that consist of repetitive behaviors and compulsions.
Okay.
OCD itself, obsessive compulsive disorder. This is you obsess. I think I go into them. So you obsess about a certain situation, and then you do compulsions to try to reduce the obsession. Body dysmorphic disorder. We're not going to talk too much about body dysmorphic disorder. This is for people who develop eating disorders, for instance. You're very, very thin, but you still look at yourself and you think you have an obsession about being thin because you think you're fat, and therefore you do repetitive either bulimia or anorexia or other things to make yourself feel better. Hoarding disorder. Hoarders, so people who will gather things and keep them. That's a pure anxiety related thing. Why do we collect things? We collect them because they make us feel safe. You feel protected. You feel like you're never going to lose out in life, because now, you know, one day when you need that flashlight, you have 500 of them.
Yeah.
And you hoard so much that you could never even really find the thing anymore, and it becomes kind of just a protective layer of items, materials. And with our kids, you often see hoarding in the beginning phases. Sometimes you'll have a child who even has a hoarding drawer. Like they have a place where they put all their stuff, or they just carry things in both hands, you know, or they have a blanket, or they have an animal that they have to take with them. Or, you know, certain things have to be a certain way, like they will insist on wearing certain clothes or not other clothes. And these are all, if you really start paying attention to it, these are forms of OCD. These are compulsive behaviors.
Okay.
Trichotillomania is the obsessive-compulsive behavior that some people have, where you pull out hair. You're anxious and you get into the habit of pulling out your hair. Excoriation disorder is actually kind of interesting, and I've highlighted it here because excoriation is people who have anxiety and they pick their skin, right? So a lot of people pick their skin. You see this in our kids quite a bit, actually. Okay. Some of our kids do this to a very, very extreme level where it becomes very dangerous. Substance or medication-induced OCRD, which is the obsessive-compulsive and related disorders, as I mentioned with our children, there are many medications you take. There's a form of niacin. You take niacin, it's vitamin B. It's not a big deal, but it gives you a rush. Yeah. I don't know if it makes your whole head hot for a few seconds. Yeah. And a lot of our kids will experience that as something that is anxiety-provoking.
Okay.
And of course, there's other specified types of this, and then there's body-focused repetitive behavior disorder, which is kind of an interesting one that they've listed here, and it really makes me think of our kids, because it is all of the hand flapping, body rocking, all of these types of things. It's funny, some people in general, when they're anxious, they tend to do things like this. Or, you know, if you really think about it, people, you're anxious and you move your leg a lot, or tap, you know, or like if you just are tapping your hand on the table, those types of things are called body-focused repetitive disorder. And if it gets to a point where it's disruptive, then it can be considered a disorder.
Okay.
I'm going to give a break in a second.
Do you want one now?
No, if it's okay, I want to keep going for a few more minutes, because I really want to fit as much as I can in. Some of the commonalities are like cleaning or, you know, contamination disorders. A lot of people experience that something around me is dirty and therefore I have to clean obsessively. Here's one of the cool ones that they've listed now and I wanted to talk about, is symmetry, an obsession with symmetry and repeating ordering. Obsession with symmetry means things have to be a certain way that is symmetrical, perfect. Nobody knows what that really is, but they have to be a certain way. And that is so many of our kids, where things have to, and that, notice this has nothing, I'm not reviewing autism, I'm reviewing OCD, I'm reviewing anxiety. And these are symptoms of those disorders. So they're, you know, when you have a child who insists on things being symmetrical in a certain way, that's anxiety. It is an indication that they're feeling anxiety. We're going to skip the other two because they're not important to our current discussion here. But what's important here is genetics. When you look at genetic components of obsessive-compulsive disorder, the rate of obsessive disorders, or what's called obsessive-compulsive and related disorders amongst first-degree relatives, is double the normal population. The rate of obsessive-compulsive and related disorders amongst first-degree relatives when the person with obsessive-compulsive disorder was diagnosed as a child is 10 times the normal population. So in other words, if you are diagnosed as an adult to have obsessive-compulsive behavior, the likelihood that one of your immediate relatives, like your child, would have one is double. The normal population would have obsessive-compulsive behavior as well. If you are diagnosed to have obsessive-compulsive problems as a child, the likelihood that your child, when you're an adult, will have it is 10 times normal. So there's a huge genetic component.
And what this says to me is that as parents, we have a responsibility to get help for ourselves if we're having anxiety, and that if our children are having anxiety, that we need to get on top of that, or we're going to have grandchildren who have
and you know,
anxiety.
it's funny that it's right now, of course, this often happens in, you know, these studies on genetics, they're done with groups of people, and they notice that, oh, if somebody was diagnosed with OCD as a child, they've grown up, and now how many, you know, we're studying adults who were diagnosed when they were kids. But you can also think of it as, is this really genetics, or is it really environmental? If someone has OCD as a child and they're not treated, it's very likely that they go through life with OCD, and their kids will have OCD. I had a parent who used to come to the clinic, and she would have a mask over her face and would only come in with a Lysol can, and her child was very, very anxious, and the parent wouldn't let her child go to school because she was afraid that the child would bring germs home and infest the house with germs. I mean, our behaviors really impact our kids' behaviors.
Absolutely.
So this is very, very important to pay attention to.
Should we give you a break?
Let's take a quick break.
All right, we're going to take a break, and we have some questions that have come in, and hopefully we're going to have time to get to some of them. One in particular about helping older kids on the spectrum that are in that transition phase that are experiencing anxiety. So stick with us. We'll be right back after these messages. Welcome back to Ask Dr. Doreen. We're so thrilled that we have Dr. Doreen Granpeesheh with us, and she is doing for us the part 2 of the anxiety show, which I think is going to have to go into part 3 eventually. But we should say that you are someone who has been dealing with autism. You're an expert with the field of autism, and I always like to remind everybody that you're a visionary in the field of autism, and so it's so wonderful to have somebody with your expertise
Thank you, Shannon.
taking this for us and putting it in terms that we can begin to understand, so we can start to help ourselves and help our kids.
Right. Well, thank you. I appreciate that. That's very kind of you. But I really believe that a lot of our kids and adults experience anxiety, and it's one of the things that really is ignored quite a bit.
Absolutely.
And so what I'm going to do now, because I do have a lot of slides, but a lot of questions that have come in have to do with just the treatment aspect of it. So what I'm going to do is I'm going to just tell you about the next slides, and hopefully you will go in and look at this PowerPoint. And I think, Shannon, what we should do for this talk is at some point I'll schedule with Emily and do more of a 2 or 3 hour long video on just anxiety as a whole. So, you know, the next slide was going to talk about why would individuals with ASD have anxiety. And this is really important because, you know, if you just quickly take a glance at these things, our kids and adults on ASD who have ASD experience a lot of things we don't experience. Like, they don't sleep enough. Most of our kids don't get enough sleep. There's a lot of illness stuff. It's funny because if you go to a restaurant, if you get food poisoning and you have severe GI symptoms, the number one thing people with severe GI symptoms say they have is anxiety. It's an identical feeling when you're throwing up and you have diarrhea and so on. It's an identical feeling to when you have severe anxiety. So there's a huge overlap. And if a child has GI symptoms, they're going to feel anxious all the time. Sensory overload makes us anxious, and our kids, we know, have a lot of sensory overload. Being on medications, receiving treatments, like, you know, if you're going to get a methyl B12 shot every 3 days, you have increased anxiety. You know, I don't know how my kids would handle it if I told them you're going to get a shot every second day or every third day. Just imbalances in our neurotransmitters, which a lot of our kids have imbalances, will cause anxiety. And there's a lot going on with our kids that increases their propensity to have high levels of anxiety. And the ways that they show it are, they do have obsessive-compulsive behaviors, like lining up objects, which they're trying to control their environment. Hoarding, which gives them a sense of safety. Body rocking, which, by the way, body rocking is one that I like to talk about. This motion actually is one of the few motions that activates parasympathetic activity in the brain. So we have sympathetic activity and parasympathetic. Sympathetic is when you are ready for the fight or flight response, and parasympathetic is the calming response. It's your body is reacting to a stressful situation, and your parasympathetic activates in order to calm you down. This body rocking is one thing that you can do that will actually activate your parasympathetic, which is very interesting because our kids do that. It's almost like they're naturally trying to calm themselves.
Yeah.
This is why we have rocking chairs.
Yeah.
Rocking chairs produce calming effect because of activation of the parasympathetic.
Wow.
Yeah. So, you know, and signs of anxiety will result in no sleep, in IBD or other GI issues, hives. I will always check our kids. Or in avoidance behaviors, like things like self-isolation or no eye contact, right?
Okay.
Social avoidance or self-stimulatory behaviors, which are all repetitive and rote. I'm not going to talk about the research findings just because actually, the only thing I want to say about this slide, which is amazing, and I'll be very quick on it, it's just a very spectacular slide.
Okay.
Studies show that individuals with ASD experience greater levels of anxiety than community populations regardless of their age, okay? All other community populations. Individuals with ASD show greater signs of anxiety than individuals within any other clinical group. Any, okay? This is the good one. Individuals with ASD show similar levels of anxiety when compared to individuals with a diagnosis of clinical anxiety. The only other group they're similar to in their level of anxiety is people who have been diagnosed with anxiety.
Okay.
So ASD is definitely one of those that has high levels of anxiety in it.
Okay.
And of course, we talked a little bit about diagnostic overshadowing and reasons why it's very hard to assess. I've listed a few different assessment tools that might help our people identify but you know, I've already also mentioned a bunch of symptoms. If you see those symptoms, assume that it might be anxiety. Now, we're going to start talking, we have about 10-15 minutes to talk a little bit about treatment here. You know, when you talk about it from a behavioral perspective, remember we always want to look at the antecedents and the consequence of things, right? So you can do an FBA, you can do a functional behavior assessment, and you can observe it and find out what's causing the child anxiety. So time for school, Joe tantrums, and then he gets sent home, right? A challenging behavior, like a tantrum, may begin because there's anxiety. So the antecedent, like time for school, is causing anxiety, and then it becomes learned due to the reinforcement. This is a really important thing. Most avoidance is learned. It's something that we imagine. So I want to avoid school because in my head there's something about school that's causing fear, causing anxiety. Now I'm going to do a huge behavior like tantrum, and then they send me home, and great, now I realize that my tantruming behavior worked. Right? So any behavior that has an avoidance function has some level of anxiety in it, is what I'm trying to say. You know, noisy environment, Tom lines up toys, right? And then Tom gets to avoid the environment because he's obsessed with his whole thing. Is it okay sometimes to let Tom avoid the social setting, or is it better to help him cope? And those are the questions. You don't want to reward the avoidance behavior, because ultimately all of our kids have to be exposed to situations that are normal, like going to school. But there are many things you can do to help.
Okay.
So there are, first of all, the psychopharmacology treatments, which we don't want to ignore because they're hugely effective. Things like selective serotonin reuptake inhibitors, SSRIs. They're very helpful with this. The SNRIs, or serotonin and norepinephrine reuptake inhibitors. There are many other drugs. Those two are the mildest. Of course, there are others like the benzos are a little bit heavier, but these are medications that have been used for the treatment of anxiety for many, many years. Many, many years, okay? And they will reduce the anxiety feelings. Now, I'm not someone who's one way or another feel very strongly about the use of medications or not, but I will say that research shows that a combination of medication and cognitive behavioral therapy is the most successful.
Okay.
That is the way to go. So if your child has, or if an adult you know has very severe anxieties or obsessive behaviors, start with looking at researching the medications for anxiety, and the two top ones are the most common, SSRIs and SNRIs, and you will see that they're pretty benign. They will just kind of take the edge off. They sort of help you, they modulate your neurotransmitters. I can't go into the biochemistry of it too much today, but they really do help people calm down a little bit.
Okay.
And that kind of helps us then work on other things or teach better, you know, and change behavior better. Keep in mind that there are other medications that help as well. So if your anxiety is coming from having GI symptoms, then take medication for the GI symptoms, you know. So GI meds will calm the GI issues and will help your anxiety as well. If you're having sleep deprivation, get medications that will help your sleep, because lack of sleep leads to significant anxiety. I guarantee anyone, go, you know, set your alarm clock so you don't sleep for 2 nights. You'll be the most anxious wreck that exists. And that's a lot of times what happens with our kids. We don't realize that they're experiencing anxiety simply because they don't sleep. They wake up too often.
Okay, so we have to take care of business, essentially.
Exactly.
If something's going on, we got to take care of that. Otherwise, we're really not going to be as successful taking care of the anxieties as we could be otherwise.
Because if you're still not sleeping, I can give you 50 coping mechanisms for your anxiety when it happens, but you're still not sleeping.
Right.
Like, let's fix the underlying.
Okay, great.
Then we get to therapy, cognitive behavior therapy. Cognitive behavior therapy's goal is to create new coping mechanisms or new coping templates. And you use behavioral techniques like modeling, exposure, and relaxation. Okay, and we're going to talk about each of those. So exposure, which is the main thing, of course, modeling, you know, that's I don't know if I go into modeling or not, but modeling, you know, most of the time what we're doing is we're modeling bad behavior for our kids, but because we ourselves become anxious. But if you, like, okay, so an example of this is if a parent has serious anxiety about, let's say, spiders, guaranteed all kids in that family will fear spiders. So if you are able to overcome some of your own anxieties, then you can model for your children. If a parent goes and touches a spider that's not harmful, children won't be afraid either. We learn from our parents what to fear, or from someone else.
Right.
If we see someone scream and freak out, we will realize, oh my God, there must be something to be anxious about. So don't model anxious behavior.
Okay.
Exposure, this is the most critical treatment, and it will help anyone with anxiety, OCD, any kind of phobia, and it is a heavily used intervention. We use it for so many different things. It's called systematic desensitization. Remember when I said flooding is forcing the person to be exposed to the thing they don't like, just throwing them into the anxiety situation? Systematic desensitization is sort of a way of doing that more gently. There's 3 phases to systematic desensitization. There's exposure to a hierarchy. Essentially what you do is you produce a hierarchy of things that are anxiety provoking. So let's say, you know, I don't know, going to a party is anxiety provoking for an individual, and what you will do, or touching let's look at serious OCD, like touching a particular object is dirty. And that is really, I'm going to avoid that completely. So what I'll do is I will have a list of things that are the highest to the lowest anxiety provoking. So the lowest, I'll use an example that applies to many parents, is like taking their child to a medical type of intervention, whatever it may be. Child's freaking out, tantruming, throwing fits, and so on. So you sit with you produce a hierarchy for your child that starts with looking at a picture of a doctor's office. Maybe that's even too anxiety provoking. You go to the very lowest and you'll put 20 items in there, 20 pictures, or 20 steps. The highest would be actually going to see the doctor or the dentist and actually receiving the injection or
whatever
the procedure.
The thing that has the most fear. That's at the top of the list.
That's at the top, and the lowest is the least. The second stage of systematic desensitization is teaching your child some form of relaxation exercise. Now, this could be anything. It could be breathing. We do a lot of breathing with our kids where you just breathe and count. It could be imagery. So you will teach the child to think of their favorite place, like on the beach, and really do what this is essentially just going in your head and meditating for a while. Or it could be just relaxation.
Or self-talk, or all those things.
Lay down, drawing, listening to music. There's many things we can do that are relaxing. Okay. And then the third component is pairing. So what you do is you now do whatever you're good at that relaxes you. You have to really get good at that, though. Okay. So you do that, and you pair it with the first thing on your list. Just look at the picture and you do your relaxation until the picture is meaningless. Then the next day or 2 days later, you go to the next stage. And let's say the next thing is, okay, a picture of the doctor or a video maybe. You watch the video of the doctor doing the procedure, and now you are doing your relaxation and you're no longer worried. The third or fourth day, now you're going to maybe even get in the car and drive to the doctor's office, but you're not going up. That's all. You just drive to the doctor's office and you're relaxing, and or your child is listening to their music and now they're much better. The fourth day, fifth day, it might take a month, doesn't matter. And you just gradually work your way up and you pair each step with the relaxation procedure. So you might have to drive to the doctor's office 5 times and just sit in the car and listen to music, but you do that until the child is no longer anxious.
So essentially, we've taught them a coping skill, and then we're gradually letting them try the coping skill out in a way that they can be successful so that we can get it further and further along.
Yes, and you pair the coping skill with the stimulus that's causing anxiety. Yes, exactly. You get what you're doing is you're classically conditioning each level of the anxiety to neutrality, to the relaxation, so it's not going to be anxious anymore.
Okay.
Now, when we do these techniques with our kids with ASD, you use a lot of visual stimuli. Like, I'll give some examples here. A toolbox. So you will teach your adult or child many techniques. One could be breathing, one could be, whenever I feel anxious, I need to listen to music, it helps me. One could be, I like to draw, drawing calms me down, whatever they are. And you put them in the child's toolbox, and you help your child pick. The next time they start to get anxious about something, you say, hey, what's in your toolbox? What are your techniques? Pull one out and do it right now. You pick. And you can use visual things to help the child to identify what they have. What are their strategies? You give written schedules. For instance, a lot of times our kids are anxious. This is when parents tell me they hate transitions, right? So write down their entire schedule. Do you know how much anxiety that reduces for our kids just knowing what's coming next? We just take our kids and we do, come on, we gotta go this, and the child's like, good Lord, what's happening to my schedule? What am I doing
And
today?
we would react badly if somebody did that to us.
Oh, everybody,
That's what's fascinating. I do it all the time, but if somebody did that to me, I would freak out.
Absolutely. And so it's very important for our kids to actually know what's going on. So transitions are important. Narratives. Narratives are things like you will write, like social stories is a narrative. Social stories, for instance, you can just write narratives like, I am the boss. Anxiety is not the boss.
Right.
That's it. Something like that for the child. They can write it down on a small piece of paper, like one of those things in cookies, put it in their pocket. Whenever they're going somewhere, they pull it out and take a quick look at it and put it back. I'm the boss. Anxiety is not the boss. Just something as simple as that. Stories are very helpful, where you can tell stories of someone who was worried about something and then they overcame it. You role play, just role play the whole thing at home of going to a party or going to school. I mean, it sounds silly, but it really helps our kids. Choice lists, like when you are in an anxious situation, what are your choices? What are the things you can do? It's fine to walk away. That's totally fine. So therefore, what are you worried about? You can walk away from it.
Right.
What are you worried about? If you're at a party alone and you can't get away from the noise, can you go to the bathroom? Maybe it's more. And these are appropriate things. And hey, we do these things. Haven't you ever been, I get anxious because my kids talk to me all at the same time and I've already had 12 hours of work and I'm dying and I haven't slept and there's a million things, and I'll just literally go in my closet and stand there for 5 minutes just to breathe and calm down.
Yes.
Drawings are very useful to our kids, like thought bubbles, cartoons, like helping we do a lot of cartoon comic strips, where our child will, let's say, throw a fit or a tantrum, and then we'll say, okay, let's talk about why this happened. So this is you, and we'll draw a person, and this is the other person, and how are you feeling? And we'll put some sort of feeling in the bubble next to the heart. And what did you do? And then we'll draw something like, so you threw a book, you threw something, or you hit this person. And what were you thinking? You were thinking. And we help our kids identify what they were thinking that led to that level of anxiety and reaction, or
That's right.
avoidance. And then you'll say, what other things could you think? And then you'll try to replace them with some of these more adaptive coping strategies, like, oh, you could think, there is nothing to be afraid of. I can always leave. I'm going to be successful. So reversal of your own negative thoughts,
So really empowering them.
Oh yeah, absolutely. Rule lists of emotions for coping, rules lists of what's normal and what's excessive. Like, keep in mind, none of our kids really know how to do these things.
Yeah.
They don't really know.
They don't have a reference point.
They don't. They really don't. And I'm just going to keep going. I know we're going over a little bit, but I want to get through just maybe this slide.
And I've got a couple
the next
of
slide
questions
is
I
the
want to at
last
least
slide.
touch on.
Absolutely.
Okay.
Now, let me just give some more examples. Like, use concepts that are interesting. For instance, astronauts exploring a new planet, right? That's a really good example, because imagine for our kids, it feels like they're exploring a new planet, right? And if you show them, like, look at those astronauts and look what they did, and you're exploring, so go and see what's out there and come back and tell me, and that gives them courage. Or like, there was one child who had a Harrison Ford obsession, like was completely, and the way that the strategy was used to just say, what would he do? What would Harrison Ford do? And then whenever we drew comic strips, it was always Star Wars cartoons, right?
Fun.
Or use self-stimulatory behaviors as a way to reward themselves. This is called the Premack principle, where essentially you will allow the individual to, for instance, use line certain things up that don't seem as odd.
Okay.
Like, for instance, how many people have, engineers, I love when they have like 10 really sharp pencils in their pocket, or mechanical pencils or something, or when we have like a pencil case and all of them have to be like sharp, or hey, how many people have really, really organized sock drawers or whatever it is. Hey, allow those things, because they're adaptive ways of being obsessive.
Right.
Okay, and just don't allow the ones that are not. Like, as I said, organize. Let your child be obsessive in certain arenas, but just not others.
Okay.
I think the last slide is just talking about, like, really take care of the anxiety in yourselves, because the more anxious you are, it really does affect our kids as well.
It starts at home.
Yeah.
As always.
And let's see if some of I do want to tell our parents about our viewers about one type of therapy called acceptance commitment therapy. I'm pretty sure Evelyn Gould would have talked about this.
Yes.
It's a fabulous intervention. It's a fabulous type of treatment. I really recommend it for a lot of people. It helps you cope with anxiety. It helps you cope with fear. It helps you accept things. I know, maybe next show we can get into, Shannon, how just having your child diagnosed with autism causes a lot of anxiety.
Yeah.
And how we can really help our parents cope with these things. I've put in some of the things, some specific treatments. Actually, what we should do is talk about just ACT in one of. Has Evelyn done that already?
She has, but we can. There's always more to talk about.
Okay.
So absolutely, I want to get to a couple of these questions, and one of them, it's going to be seemingly off track, but it's a 911 from a parent who's having anxiety right now because their child is about to go in and get tested for diabetes, and they write in and say, "I know gastric issues are common with ASD kids, but is diabetes common? My son is being tested in 30 minutes again for this, and he is only 4."
Right. I don't know that it's common. I don't have too many kids with diabetes, so it might not be common, but doesn't matter.
It's important to get the test.
It's very important to get the test, and don't worry, don't freak out. It's not a big deal. There are so many children who have diabetes and they handle it and they learn to cope with it and they learn to self-inject, and it's not or check their own blood later on in life. He's 4. I know. I hear your pain. I honestly do. But don't see, this is what I'm saying. This is what happens. We become apprehensive about stuff we imagine.
Right.
Maybe it's good for him right now. Maybe later in the future we learn learn that we all need to watch our insulin levels. Just go with it.
And if it comes back positive, it means that he needs some help, which you would do. So
and
this is a good thing that you're
exactly.
this is a
and
good
it's
thing
so
that you're
important
getting
to
this done.
know. Right.
And somebody wants to know, it's sort of that chicken or the egg. Does anxiety cause the stomach issues, or is it the other way around?
Oh, I love the person who wrote that in. That's part of the one of the slides that I had to take out because this is so long. I always think that myself. Which one is causing which?
Yeah.
Very, very good point. And they perpetuate each other, obviously. Absolutely.
Absolutely. So the answer to that is we don't know.
We don't know. We don't know.
And it could be different in different kids, couldn't it?
Absolutely. And you know, when you look at kids with autism, if you think about, and I've said this on the show many, many times before, but if you think of kids with autism as, just put yourself in there. That was my Hong Kong experience. You know, it's kind of like, okay, you have sounds that are too loud, lights that are too intrusive, you're not sleeping well, you have GI issues, you're not comprehending much of what's going on around you.
Right.
Believe me, you will feel anxious.
Yeah. And as you said, that doesn't have anything to do with autism necessarily.
Not at all.
That could be any kid, any of us. You're having GI issues, you're going to get anxiety, and if you have anxiety, you're probably going to get GI issues.
Absolutely, that's right. You take any typically developing child, fly them to some other part of the world, make sure they have jet lag, and throw them in a school where they don't know how to communicate with anyone, and culture.
Mess with their diet.
Mess with their diet, and their culture is completely different, and believe me, they'll react just the same.
Okay, next question. Can children outgrow anxiety or separation anxiety? Is it just being a child and feeling small in the world that can trigger it?
Whatever the trigger is, you need to act in order to get them off of separation anxiety. Separation anxiety is often because we give in. Our kids will probably start. So here's how it goes. That's that slide that I said a lot of times this is something that is instigated just naturally. Okay, so of course your child is bonded with mom and dad more than anyone else, or mom and someone, you know, caretakers, guardians, people they feel safe with. And now you're putting them in a school environment where they don't know anyone, so they're going to feel unsafe, which will equate to anxiety. But you have to go back and you have to do a planned intervention. And it's exactly what I said. It's the systematic desensitization.
Yeah.
Graduated exposure to the school environment with coping strategies will help your child get over it. And if you don't do that, no, there are children who have separation anxiety even at the age of 10. There are adults who have separation anxiety because nobody ever helped them get through it.
Okay, so we shouldn't have an expectation they're just going to work it out on their own.
They might, and the only reason they work it out on their own is because they're flooded, they're thrown into the scenario, and they realize they're safe.
But that isn't necessarily the kindest way to do it.
It isn't, and it's not the guaranteed way that they'll get through it.
I sort of feel like we've answered this a little bit, but I want to backtrack a little. Does this apply to kids without autism as well?
Absolutely.
It applies to all of us.
It applies to everyone. We all experience anxiety. It's just a matter of whether we have the ability to cope with it at different levels or not.
Okay.
And, you know, a lot of people, as I said, remember the first slides, a lot of people deal with it in adaptive ways, not adaptive ways. And, you know, the issue here is to try to teach our kids more useful and adaptive ways to cope.
Okay, this next one comes from, I don't know if you remember, the first time I ever had you on a radio show, the first caller that we got, it's this person who I've become very good friends with.
Wonderful.
But wants to know, they're having lots of problems with OCD-type behaviors. The older her son gets, he's now a teenager, the more pronounced they are, and he's had 5 black eyes self-inflicted in the last 3 months simply out of frustration because his OCD needs aren't being met.
Okay. This is a very severe situation. Here we go. Is he on any medications? Get him on an SSRI medication, first of all, please. That will help take the edge off him immediately. It will really significantly help. Secondly, start from scratch. Allow him to have all of his OCDs for a while. Okay, start with that. That's your baseline. Start working on teaching him some other techniques, relaxation techniques. Does he know how to meditate? There are very, very good tapes out there. I don't know what his functioning level is. Perhaps you know, Shannon, but there are amazing tapes or DVDs or CDs, even online, that you can play that are 5 minutes, 20 minutes, that they will literally take you into a dream state and they calm you absolutely, and they're beautiful, and it's visual imagery. Maybe that doesn't work for him. Maybe music works for him. Get him some headphones that are noise canceling, put them on, and allow him to listen to calming music. Maybe rocking calms him. Teach him something that is calming. When you've identified what that is, do desensitization. Start to talk about the worst thing in his case is his routine not being done, his compulsion not happening. Okay, I don't know what they are. The easiest is one step away from it now. So in other words, let's say he has a compulsive behavior of lining up objects. The worst thing that could happen is he's never allowed to line up objects, or someone disrupts his objects all the time. Just as an example. What if you start with the lowest being, oh, we disrupt the line, but you can form it again immediately. Okay. And you just make the hierarchy all the way up. This hierarchy will differ based on each individual's actual fears and compulsions. Start gradually teaching him how to cope with change.
But wouldn't you say at this point it's important to get some extra help, like you were saying, get some medical help, but also time to get maybe a cognitive behavioral therapist, you know?
Definitely. I mean, if you have a child who's now an adolescent and is giving, you know, self-injuring, he's scared to death. Yes, please get him help. Please get him help. Get him medical help. And get together with a cognitive psychologist.
Okay, great. And our last one, how do we deal with anxiety with adults, not just children on the autism spectrum, young adults that go into transition or higher education and independence sometimes face anxiety with the changes in this transition. We see this as a growing field. As more of our kids get better and they go out into the world, they're having anxiety. Any advice for young adults with autism that experience anxiety with these transitions?
Absolutely. And we could, I mean, I'm happy to do another show that just answers questions, but again, ask yourself, what tools do they have? What's their toolbox consist of? What do they have when they go out there? Is it a physical fear or is it a mental fear, right? Do they have books they can read that helps them to calm down? Do they know how to meditate? Do they have all their favorite music? Do they have all friends? Do they know how to connect with you when they need to? What are the tools that you've given them? And just, you know, maybe read the information that I'm sending here on ACT that will actually help you teach them ways to reevaluate. See, what we do with our fears is we tend to label them, and then that becomes scary. Yeah. But, you know, there's a lot of different techniques that help you just calm down. If your child or adolescent is leaving, and my daughter just went to college, obviously there's a ton of anxiety involved with it. I think there have been days where I've just finished work and gone straight up to Santa Barbara to spend the weekend with her, or just the week, you know, or a day or two. So you do a graduated thing. She basically doesn't need me anymore right now there, but she did at the beginning of the term. So you observe those and don't panic about them, and you get help.
And somebody wrote in and said, thank you for this amazing information, very helpful, and as a parent I feel that I have some clear ideas on what to do with my 9-year-old.
Wonderful.
So thank you.
I'm very glad.
And we have to let you go now. We have to, because we've kept poor Nancy Alspaugh-Jackson waiting. But I do want to say that the next time that we'll be doing Ask Dr. Doreen is on January 8th. So we'll continue. Sadly. Well, because the next two weeks are holidays. But you'll be able to go back and watch this and the first one. And when we come back on January 8th, we'll be answering questions. So we'll keep questions, and you guys can write in after you've thought some more and tried some of these things and ask some more questions. And
I really want to wish our viewers a wonderful Christmas or any other holiday that you're celebrating right now, and a happy, happy, happy New Year. I'm really looking forward to 2014, and may all of your children continue to do well and flourish, and may 2014 be a peaceful and healthy and just a wonderful year for everyone.
here we
There
go.
we are.
Good morning. Good morning and welcome to Let's Talk Autism with Shannon and Nancy. I'm Nancy Alspaugh-Jackson.
And I'm Shannon Penrod.
We had a
We're
little
thrilled to be-
freeze going on there.
Yes.
Hopefully we won't freeze again.
We have gremlins this morning.
We do.
But you look so beautiful today. I've been telling you that. You just look great.
I ran into, got a $25 blow dry and went into Planet Beauty and they did my makeup.
Wow. Well, it's working for you.
Well, thank you, my dear. And I got a haircut. It's kind of winging out, though, I noticed. But anyway.
It's very Marlo
it's
Thomas. I'm kind of loving it.
Okay.
But anyway, thrilled to be here. We're starting a little bit late because
Yes.
we ran that segment with Dr. Granpeesheh and it ran a
Yes.
little long. And we have 2 guests, so we don't have a lot of time to frog around here.
Very exciting because we're talking about swimming for children on the spectrum, which is really important given some of the recent stories in the news. And as we know, so many children on the spectrum have been involved in drowning accidents.
Absolutely.
So this is a very important topic going into summer. But we do have some good news.
Yes.
And that is that 2 teenagers that were missing. One was a pretty high-profile case that happened in Brooklyn. On Friday, they announced that a 14-year-old boy with autism from Brooklyn was missing, and the news was it was all over the news, which I was happy to see in New York. And they found him on Monday. Alicio Cortez was found in good health at 7 a.m. on Monday morning at Dave and Buster's, where he had apparently spent the weekend playing video games.
Yeah, thank heavens that he's okay.
Thank heavens.
Because we've heard so many stories that didn't end happily.
Oh, I know. And the mom was really outspoken about the fact that she had asked for an aide for her son to get him onto the bus and get him home safely, and she had been working with the district his school district to try to do this, and that she had not succeeded in getting him what she felt was the proper support at the public school.
Which is so disappointing in light of what had just happened with Avante Oquendo.
Exactly.
I hope they're paying attention because this story ended happily. But how many times had Avante gone missing before it ended in tragedy?
I know.
4 times.
4 times.
4 times.
Inexcusable. We won't put up with this anymore.
That's right.
And we're going to call out these cases every time we see them. Yesterday, it was announced that a young man had gone missing in Richmond, Virginia, where, I grew up. My best friend had emailed me this information that a young man named Tayshawn Banks had been missing on Tuesday. They did find him last night. So thank God for that, because there have been so many stories out of Virginia with missing teenagers on the spectrum, and we've been involved in quite a few of them. So
we know that statistics show that it's over 50% of the kids on the autism spectrum will at some point elope. And as we know, a lot of times that leads to death by drowning. It's timely that we have a wonderful guest who's going to be talking with us. This is National Drowning Prevention Month. Okay. So we've got Tammy Anderson, otherwise known as the Swim Chick.
The Swim Chick.
And she's going to be with us. A little later on in the program, we have Doug Marrone is going to be with us.
And Doug is working with ACT Today. We are one of the beneficiaries of the Ride for Autism, which is a big event that happens every year in Calabasas at the Sagebrush Cantina, where a bunch of motorcyclists ride from, I think it's Baldwin Park, to Calabasas. And I went last year, and it was just amazing to watch these hundreds of cyclists come in, and they have a pre-event, the Wine for Autism event that Doug is going to tell us about.
Okay, great. So all of that and ever so much more when we come back. But first, take a look at this, and we'll be back.
Welcome back to Smarty. This month we're going to be making a mandala. Mandala, you ask? What's that? Well, in Sanskrit that means circle, and you'll see what I mean in just a moment. Okay, the materials you'll be needing for this project are colored paper, scissors, and glue. I'm assuming a lot of you guys have made paper snowflakes before. Well, this is the same idea, except for we're going to be doing it with A, lots of color, and then B, we're going to be layering it up. So, first step we're going to have to do is fold a piece of paper, so when we cut it out, there's going to be a repeating pattern on it. So what you're going to do is fold it in half, and then you're going to fold it in half again. Make sure your lines are super creased, okay? And you're going to keep doing this. You're going to keep folding it in half as many times as you can possibly fold your paper. So now that this is folded in half as many times as I physically can fold it, I'm going to take my scissors and I'm going to cut out the excess. So here's the paper with all the excess cut off. If I open it up, boom, it's a circle, but it's missing all the wonderful patterns in here that repeat. So let's fold it back up. And what we're going to do now is we're going to cut the shapes in it, kind of like a snowflake. So get creative here. Remember, don't go all the way through, or else you're going to just cut in half. So have fun with it. Okay, since my paper is, as you saw earlier, double-sided with different colors, I'm going to cut out the center part and I'm going to flip it. I know that sounds crazy, but you'll see what I mean in a second. All right, so let's open this up and take a look at it. Ooh, so you see that? I've got a perfect circle with a repeating pattern, exactly what I wanted. All right, so I've cut out the center part that I cut out for my whole circle, and let's open it up. Look at that, it's another circle, but it's smaller. I'm going to take this and place this in the inside. So the basic idea of the mandala is you're going to take your construction paper, fold it like I just showed you, and then cut different sized triangles, which will turn into circles, so there'll be layers of colors with the pattern. And of course, while you're doing this, you can talk about colors and to have them work on their cutting skills. So now that I've cut out several snowflakes, I am going to start gluing them down on a piece of paper. Here's my mandala. It looks pretty finished, and it can be. But if you have an older kid and you really, really want to hone in on working on pattern making, you can take this little scrap pieces that you cut out and have them add to the pattern themselves. Well, I hope you and your child enjoyed this project and learned a lot from it. Until next time, guys, craft on.
When you see me flying by your side.
Welcome back to Autism Live and to Let's Talk Autism with Shannon and Nancy. We have a very special guest here in the studio with us, Tammy Anderson. She's the CEO and the founder of AquaPros and the co-author of the book Swimming with Autism. She's here during National Drowning Prevention Month to tell us what we need to know about teaching individuals on the autism spectrum so that they can enjoy the experience of being in the water and be safe. So, Tammy, first of all, welcome. Thank you for being with us.
Well, thank you so much for inviting me to come up here. This is such timely information with Memorial Day just around the corner.
That's
so
right.
This will be great to get out to the families out there.
You came in from San Diego today.
Yes.
Yeah, drove up bright and early.
Yeah.
Tammy, you've got an extensive career in swimming and teaching swimming, but what made you decide to start working with individuals with ASD?
Okay, well, back in 95, 96, I had a mom that called and she said that she had a daughter with autism and she wanted to pay for a private swim lesson, but she wasn't capable of really learning how to swim. So at that time, I'm like, well, okay, I don't really know what autism is, and I had to go to the library, if that tells you anything, to get a little research because there wasn't a lot of known, documents or anything out there for instructors. And so she brought her child, and about 3 months later, I was actually able to teach her how to swim, because I wasn't going to have her pay for a private lesson, me just play in the pool with her.
Right.
So her mom was just so excited that she was able to learn how to swim. And then her mom was teaching me what autism actually was, that I realized that I needed to expand what I was doing and help more kids with autism. Because the water is like a wonderful medium for kids with autism. The hydrostatic pressure that surrounds their body, and it helps to calm them. The turbulence of the water, the way it sways, helps to calm them, so they're actually really able to learn and get in some of the information that's being taught to them at that time.
I've often wondered about that because my son Wyatt is a water baby.
Right.
And I did teach him how to swim when he was an infant because I was a lifeguard and a swimming instructor. And he just gravitated to the water, and he loves to go under.
It's the sensory.
Okay.
Because the water, when you're under the water, you're not getting all the sensory input that's bombarding you on a daily basis. So you're able to be under there. Some of the kids, like when we do swimming with autism trainings, I'll talk about that, but part of what we tell the instructors is don't assume that when they go under that they will actually come back up on their own. Because some of the kids, because they now realize that this is an awesome place to be and this is where they want to go. And this is why it's so important that we get some of these drowning prevention tips out there, because with the natural instinct to go towards the water, the fascination with the water, yet no inherent sense of danger, and the elopement, that's huge. So that's why we need to make sure that the kids are a little bit safer out there.
And you really have become an expert in this field, co-authored an incredible book that is available for people, Swimming with Autism, that details it really is a crash course in what you need to know to be able to teach swimming with autism.
Right.
But I can hear parents all over saying, well, great, there's only one of her and she's in San Diego, and you've done something about that to help all of us.
Right.
Tell us.
So Kathy Ball, the other co-author, and Shirley Fetch, she's a past president of the Autism Society in San Diego. What we have been doing over the last 4 or 5 years is we've actually put on Swimming with Autism conferences, where we have swimming instructors come from all across the world. We've had just this last one we had in February, we had somebody from Brazil, 2 instructors from Mexico. The year before that, we had an instructor from the Philippines. We just got back, we were doing a conference over the weekend in Texas. So basically what we're doing is we're trying to give these instructors some good practical information that they can take back to their pools and really feel confident working with kids with autism. Because there's a lot of swimming programs out there and they may have special needs, but not a lot of the training doesn't have in-depth training. So like at our conferences in San Diego, we actually have 60 kids with autism to where the instructors get hands-on experience. So when they go back to their communities, they can feel more empowered to just start working right away with the kids. And
so if a parent is watching and say they're in Texas and they want to know how do I know where to find those swim instructors who've been through your program, what do they do?
Right, so we have our website, swimmingwithautism.com. On that website has a list of all the instructors that have gone through our programs and swim schools that have participated, and they're all across the country. And then also on there's also some downloads for parents, free information on drowning prevention. There's also some social stories we've come up with for swimming lessons and for also being safe around the water, kind of reminding the kids the rules that we don't go swimming by ourselves, that type of thing. And just a lot of really great information. When we instruct the kids, we use waterproof iPads, so there's information there for anybody that would like all that kind of information too.
Fascinating. So swimming, what's the website again?
Swimmingwithautism.com.
And the book is for everyone, or primarily?
It's for everybody. It just gives you a good sense of, there are some families that may not even have an instructor in their area, so at least for parents it'll give them some tips. We actually sold out of the hard copies, so we're just to ebook, but we're revising more hard copies. We should have it in the next couple of months, but for right now, at least there's the ebook version that parents can just download and get some information, or instructors out there.
It's really comprehensive, and it covers teaching everyone. So if no matter where your child is on the spectrum, I think you'll love the book. So swimmingwithautism.com. We've got a bunch of questions for you, and if you want to ask a question, you can be writing it in on our live feature right now. We're going to take a short break and come back and ask the swim chick things that we want to know. So stick with us.
Hi, welcome to Camp Discovery, a free-to-play suite of fun, interactive learning games for kids 2 and up, designed by experts in autism. Camp Discovery will open your early learner to a world of new skills, shapes, numbers, colors, locations, emotions, and more. Let's get started.
Please choose a level.
Objects. First, Camp Discovery's Intelligent Preference Assessment determines your child's preferred reward for choosing correctly. Okay, got it. Let's play. Camp Discovery creates a motivating learning environment for your child by minimizing incorrect responses and maximizing successful ones.
Find the shoes.
Respond correctly and your child is rewarded with their favorite animations.
You did it.
Respond incorrectly, and our unique prompting system guides your child to the correct answer by making it the largest choice.
That's not it. Try again. Way to go.
Continue to answer correctly, and the size gradually reduces until the child makes the correct choice independently.
You win.
Success! Rewards motivate learning. Complete a round, and your child is rewarded with a fun mini-game. Track your child's progress with easy-to-read graphs. Multiple settings options allow you to customize Camp Discovery to your child's unique needs. All this in one single app, the Camp Discovery app, available for free on iTunes, Google Play, and Amazon Store.
Welcome back to Let's Talk Autism with Shannon and Nancy. Our very special guest with us in the studio right now is Tammy Anderson, otherwise known, aka the Swim Chick. And we love that she's here. This is National Drowning Prevention Month. Could that be more important to the autism community?
No, it could not be more important. We have too many stories, Tammy, as you're well aware of children that on the spectrum that end up at the bottom of a lake or a pool, and after they've eloped, and we want to prevent these tragedies, which is one of the reasons we're talking with you today, and one of the reasons why you do this work.
Right.
And I just want to say, too, that this entire week our topic is overcoming obstacles, identifying them, overcoming them. And I know that there are people out there who are watching who know that their child doesn't know how to swim, but you feel like you can't take them to a swimming lesson because you don't know who can handle the challenging, issues that come up with autism. And that's why Tammy's here to help us to know who those individuals are and to give us some tips about different things that we can do. Don't allow yourself to say, I'm not doing swimming lessons, right? It's important that we get this done. Okay.
So when is a child ready to start learning how to swim? A child on the spectrum specifically?
Well, now would be the perfect time for any child on the spectrum, but even at my swim school, we start as young as 2 months. So most of those kids will not even be diagnosed at the time. But the younger the better, the more that they're acclimated to the water would be the best.
Okay, so every child should learn to swim as early as possible, which I agree with. I started my child when he was an infant. But as far as a child with ASD, parents are often afraid because they say, well, the instructor doesn't know how to work with them.
Right.
So would you advise them to get the book and maybe expose the instructor to it?
That's a great way of doing it, and which a lot of parents have, because a lot of parents will have their kids in a swimming lesson program in their community and then realizing that their instructor maybe needs just a little bit of help, and so they will actually buy the book and then give it to the instructor themselves.
Okay.
So
Well, let's talk about
helps.
some challenging behaviors.
Right. Okay.
Okay, now we talked about how a lot of kids on the spectrum are fascinated by the water, but what about children that are afraid of the water as a challenging behavior? Maybe they'll scream, they won't go near it. How do you overcome that obstacle?
Well, it's a learning process, and what parents can do initially is when you bring your child home in infancy, you want to start making sure that their head is getting wet either under the shower or with a cup or something like that, because what actually happens is that you're giving a subliminal message that this is a bad thing every time you use a shampoo visor, a washcloth, anything that you're protecting their face. So that is what instills that fear of the water. And then also the other thing is when the parents, they get a little apprehensive, and anytime they're around the pool, they're like, don't go by there, don't go by there.
Right.
So here, when you have a child, let's say they're 4 years old, they've had their face protected their whole entire life, and then their parents are always scurrying them away from the pool, and then they're handing them off to a swim instructor. So it's kind of like,
swim instructor's nightmare, as I remember when I was one.
Right.
A child that has never gotten their face in the water, and they're 4 or 5 years old, and you've got to start there, which is not easy.
Right.
Yeah.
So whenever with your children, as soon as they're an infant, just start working. We cue the kids, 1, 2, 3, ready, go. Go means water. We gently start at the shoulders, back of the head, top of the head, let the water trickle down the front of their face, because here too, it's a sensation, the way it feels, it's a little awkward. But for kids with autism, it's anything that's new, novel, or change is always difficult. So the way that you can prepare them too is, if you're going to a swimming facility, is maybe take them there 2 or 3 times prior to the first swim lesson, so they can actually get accustomed to what the area is. Maybe go in the water with them yourself as a parent, just so they feel a little bit more comfortable, or to meet the instructors or things like that. But the more attempts that you try, and if they get a little whimpery on the first, just really, it's more traumatic drowning than it is learning how to swim. So if you just kind of can work through that little uncomfortableness and work with the instructor to get over that, then the kids will actually love the water and love the swimming, and then they're going to be crying because you can't get them out of the pool. So
don't
that's
coddle.
Yeah.
Don't instill more fear in them.
Right, and don't feed into their anxiety.
Now I want to know, what about kids on the opposite side of it who have no fear where water is concerned, that they're attracted to it? My son too.
Yeah.
I mean, when he was 3, we took him to the beach, and he went to run into the ocean.
Yeah.
Terrified.
Wyatt swam straight out through waves. We ended up putting a rope on him that I could reel him in. I mean, it was terrifying.
And this is the problem, not only with the attraction to the water, the elopement, and all that stuff. And your only best defense on that is really getting them to learn how to swim.
Right.
So they're capable of learning how to swim. People say, "Oh, well, put a life jacket on or armband floaties." But don't even get me started on that.
Don't get me started on floaties.
But
when I see them, I say,
ever.
do not use them because your child's not ready to swim in the deep water. They shouldn't have floaties on, right?
And the floaties actually put them into areas where they shouldn't be.
They put their face
They
down.
get that false sense of security. And for kids with autism, if they've had an experience with a life jacket on in a pool, they think that's how it is all the time.
Right.
But when they're eloping and they're running away, they're not grabbing that life jacket with them.
They're not going to have a floaty, right? So parents, no floaties, no life jackets to give a false sense of security.
Correct.
Okay.
Very important.
But if you have a child, in all seriousness, because I was one of the parents that did the floaties, and I did them because he loved the water, and we would take him swimming every day, but he was so busy pants, and I don't swim well enough to save him, and he didn't want to be held in the water. So what would you do with that kid?
Okay, what I would do is get you into swim lessons yourself.
Oh no, that wasn't the answer I wanted to hear.
All right, Ethel.
All right.
Then I would get you more comfortable in the water so you couldn't be in the water with him.
I'll teach you.
Or if not, then have maybe another adult in the water with him. But that's the thing. You need to have an adult in the water with them when they're learning how to swim, when they're young like that. And if you're at a pool party or something, you have to be vigilant. I can't stress that enough. There's going to be more accidents starting between now and the end of the summer because people go to family gatherings, they go to pool parties, parents are not being vigilant, and it only takes a second, and drowning is silent. So,
and this is true for all kids. We want to stress that as well.
It's for all, this is definitely for all kids.
Now, you mentioned social stories, which I think is very interesting. And that's a great way to teach your child not to swim in the deep end alone, not to swim in the ocean, right?
Because the kids are so rule-based.
Yeah.
So if you make sure that they understand what the rules are going around a pool or facility and you go over that, then that would actually kind of help. So, and even at my swim school, instead of saying no running, because a lot of times you want to tell them what you want them to do, where we have posted walking. The lifeguards, if somebody's scooting along, we're like, walk, walking. So you want to, so you want to put the positive spin as to what you want the kids to do. So that's just
so
explain
all the no-no-nos just kind of go through one ear and out the other. We want to stress what habits they should be doing. Okay.
Correct.
I always say it's like the Peanuts when the teacher goes womp 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 womp.
Yeah, exactly.
Right?
Or the dog. When you're talking to your dog and they hear blah 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 and the thought bubble. Okay. I want to talk about some other challenging behaviors. Selfish reasons. My son, Wyatt, is a water baby. He started swimming. I mean, people used to freak out. He'd be swimming in the deep end at 8 months, just paddling around with me. Your baby's in the deep end. And I'm like, I know, he knows how to swim. Well, somewhere around the age of, I think it was 3 or 4, he started splashing water on the perimeter of the pool to cool it down. It became a constant stem.
Right.
He will not stop splashing. He now loves to watch the patterns in the water. He would rather splash water all day than swim. How do you deal with something like that?
Okay, well, first off, I would redirect him away from his splashing if it was in a swimming lesson situation. I would give him something to actually hold in his hands to kind of redirect, maybe a kickboard, get him going on that. Have you tried being on a kickboard? Would he still continue to splash?
No, I haven't, because I've tried to work with some swimming instructors that, quite frankly, didn't know how to stop the behavior.
Right.
And then I had a behaviorist outside of the pool trying to instruct the swimming instructor, and it was a nightmare.
Yeah. So, and that's why with our book, Swimming with Autism, was so great, because Kathy Ball is a behavioralist, and her and I, we just kind of meshed together and combined her knowledge and my knowledge, and this is what we've come up with.
Right.
And just both of us have over 30 years of experience in our field, so it just has worked really well. But the one thing too is the instructor would really need to have the pace brought up in the rhythm of the teaching of what they're doing with your child, because he's got too much downtime if he's splashing around. He should be more active and engaged, and the way that we would have him maybe a little bit more focused is maybe using pegboards to stay on task of what we're doing, maybe using the iPad. We use waterproof iPads that we have a first then visual app, so it is showing pictures and things like that. So yeah, there's all kinds of ways, but the big thing would just be redirecting him away from that behavior and having him do something that's that he's busy with.
Yeah. Okay, good.
But it sounds like they need to be empowered to have those tools, and that's exactly what you give at your
Right.
swim conferences.
Right.
Right.
So if there's an instructor who's out there who's interested in that, where do they go to sign up to get this training?
Well, for they can go to our swimmingwithautism.com website, and then they can just contact us through there. We have a Facebook page, Swimming with Autism Facebook page, that we usually have conferences and stuff posted on there also, and we're always putting swim tips or whatever we're happening to do is posted on there too.
And
so
you're
that'd be good
working with the
information.
Autism Society
In San Diego.
and they're sponsoring some of these different workshops and trainings for children.
Right, no, actually, we use it as a fundraiser for them. So we do trainings and then we donate money back to the Autism Society.
That's remarkable.
Because we have a whole aquatic program, Pool Pals, persons with autism learning how to swim.
Okay.
So we provide scholarships for families. And then we also have family monthly pizza pool parties where we have, it's a great opportunity, even something simple like that swimming communities or swimming pools that they can offer to families where they come and socialize and in a setting where everybody feels comfortable.
And safe.
And safe, right. And then we also have a surf camp that we run in the summer. So all those programs all the aquatic programs that we run are run through that.
I think I might want to move to San Diego.
I was just going to say, what a gift to San Diego you are. And I'm grateful that you're cloning yourself by teaching other people these skills.
Yeah, we're trying to do our best to get as many instructors out there. I think on the website right now there may be 80 or 90 swim schools, that across the country, and each swim school has several instructors. So we're starting, we're getting there.
Okay, so a couple of different things you can be doing at home. Buy the book. First of all, go swimmingwithautism.com, buy the book. It's available as an ebook right now. You could gift it to your swim instructor to get that pump primed so that they'll go and do the conference. Instruct them how to look at the website to see the conference and get them at some point to one of those conferences. But don't let it go.
No,
all
it's so
of our
important.
kids need to learn how to swim.
And with the new statistics in 1 in 68, all swim instructors are going to see more and more kids, and they really need to be abreast of what's going on and how to really truly work with the kids with autism, and not just a simple little special needs course that they lightly touch on autism. It needs to be a little bit more in depth and comprehensive, and that's what we've tried to do.
I agree with you. Every swim instructor in America needs to get trained in working with children with autism.
Yes.
Absolutely. Thank you so much for being with us.
Such great
You're
information,
awesome.
Tammy.
It really is.
Yeah.
All right, we are going to take a break, and then in just a little while, we're going to be joined by Doug Marrone.
Yes, who's working with the Wine for Autism, the Autism Wine event, and the Ride for Autism.
Very good.
Okay.
Stick with us.
Hi, I'm Ryan with Autism Research Group. We study ways to improve the lives of kids with autism. One of those ways is teaching safety skills, such as what to do if they get lost. We hit the streets to find out if anybody knows the correct answer on how to teach a kid what to do if they get lost.
You're teaching the child.
What to do if they get lost.
Yeah. You're trying to make them independent so they have the skills.
Gotcha. Okay.
Well, give them a compass. Code name's good idea. Centurion.
We always have this whistle.
Oh, I'd also tell the kid, don't get scared. You're gonna be all right, man. This is just the world. This is planet Earth. You're at home here. As long as you're on planet Earth, you're at home.
As long as you're on planet Earth, you're home. This guy's a genius. With that flawless logic, he just solved our homeless problem. And as for the unique sounding whistle, although very cool, it'll probably only work if you're in close proximity. And a compass?
I have her call me.
Yeah, she doesn't have a phone. Parents are like, you're too young, you don't need a phone.
Establish some sort of meeting place.
What if they can't find a meeting place? Because sometimes the kids get nervous when they get lost.
Yeah.
So like a backup plan, plan B.
Yeah, I don't know. No, not really.
Let them go and find a new kid.
Yeah, I've got a different one. Yeah.
There's not much you can do.
There is stuff you can do.
That's right, there is stuff you can do. In 2012, myself, along with my colleagues, Dr. Jonathan Tarbox and Dr. Adele Nadowski, published a study in the Journal of Applied Behavior Analysis on teaching kids what to do when they get lost. The study demonstrated how 3 simple things, rules, role-playing, and praise, were effective in establishing these help-seeking behaviors. The benefit of this method is it doesn't require the child to have a cell phone or to have to locate a meeting place, which might be difficult if they're in a place like Disneyland. So once again, our method included rules, role-playing, and praise. Let's head back outside and learn about some of these rules.
They should yell out loud. Can't find my mom, help me.
Maybe yell out and scream for help. All right. Scream really loud. Correct. And if that doesn't work, then
I don't know.
well, they could seek help from someone.
Find an adult.
Go to a vendor, you know, and say I'm lost.
Find an adult, like a police officer or a fireman or an employee in the store, and tell them, and maybe they can help you contact your parent.
It really is that simple. You don't need to get your kid a cell phone. You don't need to establish a meeting place that they might not be able to find when they're lost and panicking. And you definitely don't need to give them a compass. All your kid has to do is 3 things. First, yell mom or dad real loud. 2, if that doesn't work, find an employee. And then 3rd, tell the employee they're lost. If they can't locate an employee, then tell them to find a mother with children, because that's probably the safest person to approach. I'm not saying that most men are predators, but most predators are men. That is a fact. I've read it in a fortune cookie. All right, so you've gone over the rules with your kid, and you've quizzed them, and they're able to tell you the correct responses so they understand the rules. But is that enough? How do you know they're going to perform correctly in a real-world setting? You need to get out there and find out if they can actually do it.
So you'd go over the rules and tell them, like, do this, do that. But how would you know if they actually knew what to do? If you wanted to shoot a basketball, and I just told you, oh, when you shoot a basketball, do this, this, and this.
I never practiced.
You never practice. Yeah, so it doesn't matter how many times we go over the rules or how well you can repeat them back to me. It's not going to change until you get on the court and practice.
Maybe do like a, a little skit with them.
Like a role play?
Role play, yeah.
Your child, you're lost in the toy aisle.
Okay.
What do you do? I'm an attendant, walking around.
I'm lost. I don't know where my mom is. And then once you practice, you just like praise them, give them feedback, like, good job, you did it.
Like reinforcing it.
Yes, this woman wins the prize for best comment. She pointed out the most important part of learning, reinforcement. Now, in our study, we used praise, but for your kid, you might have to use something else. You might have to buy them a treat, a toy, take them to their favorite restaurant where they can eat unhealthy food and run around and climb through plastic tunnels that have the unmistakable scent of urine, and then play games spending $20 to get a plastic little spider ring that they will eventually lose in a ball pit. The point is, you need to reward your child for correctly demonstrating what you've been teaching them.
Okay, I'm gonna call her. Hello, your child, Ryan. Ours is missing. There you go.
Woohoo!
Yay!
So you tested it out
I'll
in the
try.
store to make sure I knew it. I had the rules.
Yes.
We role played it, and you made sure I knew it. And then like you said, good job, and all that. Now we're good to go.
We're good to go.
All right.
Done?
High five right there.
Yeah.
So there you have it. Give your child the rules, get out there and practice, and reward your child for responding correctly. For more information, please visit us online at autismresearchgroup.org. I'm Ryan Bergstrom. Thanks for watching. Yes, ding, no. Yes, this woman wins the first. Yes, this woman. Yes, this woman wins the best. Yes, this woman wins the first place. Yes, this woman wins. Why can't I say woman? Yes, this woman wins. What's the line? Yes!
I'm just laughing because that was one of Wyatt's therapists. I just love Ryan. He's great.
He was also in our home, too.
Yes.
A remarkable young man.
Yes, he
Fun
is,
to see him
darling.
doing that.
Okay, we are back, and we have with us now via Skype Doug Marrone. Hi, Doug.
Hey, guys. How are you doing today?
We're doing
good.
great. How are you doing?
Excellent, excellent. Thank you for asking.
Good.
We're excited to have you
yes,
here.
Doug is the organizer of the 9th annual Autism Wine event. It's on Sunday, June 8th from 11:30 to 3 p.m. at the Chart House Restaurant in Redondo Beach. 100% of the proceeds benefit the Ride for Autism, and I am happy to say that ACT Today is one of the beneficiaries of the Ride for Autism. Good to be with you, Doug.
Thank you very much.
Yeah.
We have really great beneficiaries this year.
Tell us about the beneficiaries this year.
So we have TACA, which is one of our mainstay organizations. We also support Autism Society, San Gabriel Long Beach chapter. They do a lot of stuff with us. We've added 3 little words this year. And as you mentioned, we brought Act Today back again. So really appreciate you making us part of your show, and we're hoping to help your listeners.
Thank you so much. And as you know, the money that we receive from the Ride for Autism goes to grants and treatment that underprivileged children desperately need. Doug, tell us about, first of all, the Autism Wine event and what it's about.
Well, it's an event that we started 9 years ago. Someone gave me this idea of bringing a couple friends into the house, have them charge everyone $20, and we'll raise a couple $100 on behalf of autism. And I thought, well, let's see if we can do that bigger. And I reached out to a friend of mine, Jennifer Horn, and she had some wine connections, and so did I, and she had a restaurant connection, and we started it. And basically what we do is we put on this fantastic event with 4-course meal with a wine pairing, and has a beautiful silent auction as well. And every dollar that we raise goes to families with autism through ACT and our beneficiaries.
Right.
What's so unique about it, though, is we found the home a couple of years ago at the Chart House in Redondo Beach. And they are just wonderful, wonderful folks. They were able to, the Chart House is owned by Landry's, and they were able to convince their corporate office to work with their vendors and have all the food and the facilities and their staff all donated on behalf of autism.
That's extraordinary, because that's no small expense. And the Chart House, who doesn't love the Chart House?
Amazing. So how can someone get to this event? They need to have tickets. Where do they find them?
Sure. You can go to rideforautism.org, and you can get your tickets there. If you're last minute, which we're hoping to sell out this year, so there might not be some last minute seats, but we can probably always make room for one more. You can actually just show up at the Chart House 11/15 on June 8th. But we really encourage people to get their tickets online. And by the way, tickets, they're only $85. So it's a 4-course meal at the Chart House with a wine pairing, all-inclusive tax and tip. We have live music and a comedian as well, for a pretty good price.
That's
great. I got my tickets.
There we go.
Now tell us how, so the Autism Wine event and Ride for Autism are under the same umbrella?
Yes. So 9 years ago, we were doing fundraisers, and I created this one, Autism Wine event. About 7 years ago, we created Ride for Autism, and the whole purpose was just the same premise as we have with the wine event. We want to give as much money back to families as possible. We don't like the word, don't like the word administrative costs. There's a lot of those charities out there that have a lot of high administrative costs.
Right.
This event, the wine event, is 100% of every dollar goes out, so there is zero cost. And Ride for Autism does the same, not quite. We're probably around 82 to 85% of every dollar that we generate goes to families. There are some sunk costs. But Ride for Autism is one of the larger Los Angeles, Southern California motorcycle rides. We have about 600 plus riders and about 1,100 attendees. That's always on the first weekend in August.
Right, and I'm telling you, I was there last year with my son. We watched as those cyclists came in. Where did they start? Baldwin Park? Is that where they started?
Yes, we started out at Laidlaw's Harley-Davidson in Baldwin Park, and it's a police escorted ride, or at least an escorted ride. We go through the freeway systems, get out to PCH, which is the most fun because you get to go all the way up PCH without stopping for one light.
Oh, that's great.
And then we end up in Sagebrush Cantina in Calabasas.
And I got to tell you, Doug, I get chills thinking about Wyatt and I were standing there in old Calabasas as the cyclists started coming in with the police escort, and watching these cyclists come in on their Harleys, some of them all tatted up, girls on the back, you know, doing the peace and the high fives. My son was so thrilled by it. And then it just is such an amazing event. There were people with dogs on their Harleys, and I just love the event. And I love the autism wine event as well, and we want to encourage everybody to support both of these. So once again, you can go to www.rideforautism.org, purchase tickets, make a donation, support the cause, right?
Yes, if you can't make it out there and would like to donate a ticket to a family, please let us know in the comment section. We're happy to do so, and we have a bunch of families that would be delighted to come and get a break for an afternoon.
Sure.
Doug, thank you so much for everything that you do. We're looking forward to hearing more about both of these events, and we encourage everybody to go to that website to participate in whatever way that they can.
And thank you. Thank you, Doug, for selecting ACT today once again. You're such a blessing to us and to our families. We'll be seeing you soon.
Thank you so much. Have a great week.
Okay,
Bye-bye.
You too. Bye-bye.
Really great, two great events.
Wonderful events, so well run, so fun.
Yeah.
And we need more fun, don't we?
Absolutely. So rideforautism.org. Nancy and I are going to take a short break and be back to tell you about a great event that Nancy did last Friday.
Yeah, it's fun.
So stick with us.
Hi, Lisa Ackerman back with your Talk of Facts, the autism journey questions and answers that you need to help your child make the progress they need. I'm here to talk to you about one really important item. A lot of people ask me the question, well, Lisa, I want to see this specialist in another state. How do I do that? You know, I don't own a jet. I don't have the ability to fly without great pain and travel. Not a problem. We know how to get this done. So I actually encourage families, even though in travel can be a tremendous hardship getting a child with autism through security, through the plane, and in the journey to where they need to go. We have a whole white paper on TACA about how to travel with special needs kids. So it can be done. So travel, we know that can be expensive. Not everyone has an unlimited supply of cash for air flights. We love and work with this group called miracleflights.org. They're fantastic. They will fly you and your child, so one parent, one adult, anywhere in the United States, one time a year. Also in the TACA document are places to stay. So often you will have people in your life that love and support your family and don't know exactly how to help. Ask them to gift you their travel or their rewards cards or coupons for hotel, rental car. That's a great way to be able to get maybe a hotel room that has a refrigerator or a microwave and that's close to a Whole Foods, so you don't have that added cost of going out to dinner, especially if your kid has a lot of allergies. It's important to note that there's not a pediatrician or a specialist by every Starbucks in the United States. Close does not always equal best. So I bring up the travel point so you know that travel is possible, number one, and often it's really going to help you get down the road faster for your kid and getting the answers you need from the specialist that knows what to do. So don't be afraid to travel.
We are back with Let's Talk Autism, and Friday was one of the highlights of my life.
It was so exciting because you called me later on that evening, and I'd been thinking about you all day long, and I was so happy to hear about this wonderful. I was sick that I couldn't be there.
Well,
but
Emily came and Matt from your staff, and they got tons of interviews, Spanish, English, and let me just to say, it was the Autismo y Familia conference, the first one. We were granted $5,000 from Autism Speaks to put this on.
Yes.
We did it at the Children's Institute. It was phenomenally well attended. We did the whole thing in Spanish, everything you need to know, from symptoms, diagnosis, how to access care and treatment, how to navigate regional center, school, and it was attended by VIPs that I was blown away. Emily, do you have a, okay, there we go. There is Dr. Ambrose from the Children's Institute, little old me, and next to me, the dashing Senator Kevin De Leon, our ACT Espanol spokeswoman and keynote speaker, Gabriela Tessier, Univision anchor and mother of a child with autism, Mitch O'Farrell, council member, and Carlos Sada, the Mexican Consul General. What a group, huh?
Yeah.
And then there's another picture, I think, of me with Ed. Matt Asner. Why do I always do that? Ed's son and the Southern California Executive Director of Autism Speaks, and Gabriella. And the stars, really, the families. There are some of the families who attended, one of the families who attended, and all the families said to me, thank you for putting on a conference in Spanish, because they don't understand a lot of the terminology. And now our plan, I hit up Matt right then and there. I said, we're going to do a whole bunch of these next year, right? And the Mexican Consul General said, you can use all my consulates. And Kevin DeLeon said, I'm there. And it was so exciting, Shannon.
Well, clearly you hit a nerve, right? Because you did it all in Spanish, gave really good content, it was free, and you gave free experienced childcare.
Yes.
So you did it exactly
and we gave
right.
resource kits, and our plan is to do at least 5 of these next year, so stay tuned. We're going to be doing them all around the state.
I got to say, I'm proud of you.
Thank you.
Proud of your girlfriend. That was a wonderful thing that you did, and clearly
I'm
it rang a
proud.
bell with a
Gabriella
lot of people.
Tessier, let me tell you, she's a combination. You call me Mother Teresa. She's Mother Teresa meets a rock star to the Hispanic community. Amazing.
I'm impressed. I'm impressed, though, because the whole thing would not have happened if you hadn't been saying this is what's going to happen.
Well, as we know, it's the fastest growing population in autism, the Hispanic community. The average age of diagnosis, 8. That is criminal. We have got to do something about this.
It is criminal. All right. Well, thank you for doing it.
All right.
And I can't wait. I want to come to the next one that you do. We're here at the end of the show. I want to remind you of a couple of things. Some of you were writing in questions today for Dr. Doreen Granpeesheh, who wasn't able to be with us. I want you to know that we're taking those questions, and tomorrow we'll have Dr. Jonathan Tarbox answering those questions with us in the second hour of the show. If you feel like you need a question answered sooner, please make sure that as soon as possible you message me with an email and I can get somebody to talk to you. I hate making you wait another 24 hours when you planned on Dr. Granpeesheh being here, but we will get you an answer tomorrow. Also, Dr. Adele Nadowski is going to be with us tomorrow, so we have a really exciting show for you before this 3-day weekend. Great resources. But I thank you all for being with us. We want to thank our guest today, Doug Marrone, for the Ride for
and
Autism.
the swim chick,
and Tammy Anderson.
Yeah.
Really important information.
I'm going to go pick her brain right now on more stuff.
Well, this has been a very interesting season. I feel like we still have April ending up, because you had the conference looming large.
Yes.
But there's so much exciting that's happening. And the thing that you said to me on Friday, and I said back to you, you said, I feel hopeful.
I do feel hopeful. And I just want to mention before Memorial Day, I want to give a shout out to our military families.
Absolutely.
Our military families who are affected by autism, especially hard hit because of the frequent moves, having to reapply for services. Act Today for military families. You can make a donation in memory of a loved one. I think of my dad, who was a decorated Marine. And please support our military families with autism and our military families in general.
What better way to do that? To make a donation in their name?
Act Today for militaryfamilies.org.
There we go. We're out of time, but we will see you next week for Let's Talk Autism with Shannon Nancy. I'll see you tomorrow for Autism Live. Until then, please give your kiddos a hug from me. Bye-bye for now.
Give yourselves a hug from me. Bye-bye.